autoimmune diseases like rheumatoid arthritis, juvenile diabetes, lupus, Crohn's disease, all this IBS.
Just a few decades ago, 1 in 10,000 children had autism. Today, it's 1 in 31.
ADD, ADHD, speech delay, language delay, tics, Tourette's syndrome, narcolepsy, sleep disorders.
There's no way in the world these kind of rapid increases in the incidence of disease could be genetic. Genetic change takes generations, centuries to play out.
What the heck is happening?
Well, the producer and filmmaker behind An Inconvenient Study, you saw a clip of just there, Del Bigtree. I'll tell you where you can find him in just a moment. We'll be discussing that and other Maha highlights. But this is an award-winning film. He'll tell you where he is, what he won and where. He is the host of The High Wire, also the CEO of the Informed Consent Action Network. Sounds like something I could sign on to. And I'll tell you more about Del and where you can find him in just a second. Then Matt Palumbo's coming in here. We're going to talk about dark money and billionaires. But first, Del Bigtree.
Our laws, as it pertains to substances, are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want help stop it, I can help. I got a lot to say. I got a lot more to say.
Paleo Valley is always innovating, bringing you new products to market, of course, using doctor.com/Paleo Valley. You will get 15% off your first order and 20% off when you subscribe. And of course, one of the first things I promoted and consumed quite a bit of when the company joined our family of sponsors was the grass-fed and finished beef sticks. And that remains a fan favorite and a personal favorite as well, particularly the classic and the summer sausage. These delicious, chewy sticks have higher levels of omega-3 fatty acid than conventional beef. They're naturally fermented and contain 0 grams of sugar, 0 artificial preservatives, 0 gluten, 0 soy or corn. I eat them sometimes before a show or after show, between meal breaks. Certainly when I travel, I bring them everywhere. Use it before a workout so I don't get super hungry. All the protein stick varieties are superior to your typical jerky. Paleo Valley is a wonderful small business that promotes healthful eating and supports this show. Get 15% off your first order with drdrew.com/Paleo Valley. You can find Del Bigtree on X, Del Bigtree, at Del Bigtree, and inconvenientstudy.com. He also had previously produced Vaxxed, and he was the communication director for the Kennedy 2024 campaign. Del Bigtree on X. Del, thank you for coming back. Congratulations on the film.
Thank you, Dr. Drew. Thanks for having me.
So tell us exactly what your competition was, what you won, where you won it, and what it means.
Well, we were accepted into the Malibu Film Festival, which was held at the DGA Theater, which is sort of an honor, especially as you know, the climate around this vaccine conversation, to be in the heart of Hollywood, the DGA. There was something really special about that. Of all the films that they had there, they had shorts and drama and, you name it. We got Best of Festival, which was the highest prize at the end of the festival. I'm not sure how many films they had, 15 or 20, something like that. But it was great to be honored that way. And, we had an amazing red carpet. We had Jenny McCarthy and Isai Morales and different movie stars. Drea De Matteo was there. So it was just a blast. The whole experience was really lovely. And the vibe was awesome. And we packed out the big theater there. So it was a great weekend. It's a great way to launch an Inconvenient Study, which right now is free for everybody. We didn't want to go through wasting time on a theatrical release. So people can just go to inconvenientstudy.com and watch it right now for free.
Okay, that's what I was going to ask. And of course, Jenny and Dre are friends of ours, and Issei too. I haven't seen him in a long time, but he used to come on the radio with me back in the day. So, is the fact that you're now an award-winning film what got you guys put in the crosshairs a bit, or was that already happening?
That was already happening. We received a cease and desist letter several weeks ago. I think it was three or 4 weeks ago. We received a cease and desist letter from Henry Ford. Because we had already put out the trailer on the film, we were starting to announce that we were going to be screening it. And at the center of it, at the center of the controversy really is they're saying that there's defamation taking place. Essentially, what they're saying is, our film, and by the way, it's not me saying it. I had hidden cameras and recording equipment, so I had gone to have dinner with the lead author on this study. And it's basically a vaccinated versus unvaccinated study that I challenged this Dr. Mark DeServos, is his name, is the head of infectious disease at Henry Ford Health. I challenged him back in 2016. If vaccines are making us healthier, why don't you prove it by doing a vaccinated versus completely unvaccinated study? And he agreed to do that. Anyway, by 2020, he finally did that study and then refused to publish it. So I went to dinner to ask him why. And the heart of this film is really around that conversation that we had where he admits, I think it's a good study. I would publish it just as it is. The only reason I'm not is I would lose my job. I'd lose my career. I'd be finished. And he states that unequivocally over and over again. Henry Ford asserts the only reason the study was not published was because it was a bad study, bad data. So that's where the conflict is. They think we're misrepresenting why the study wasn't published. But when you watch the film, we leave it for the audience to decide. It's really, you have to ask yourself, is this world-renowned virologist, head of infectious disease at Henry Ford lying? Is he incapable of knowing what a good study is? All of that is the heart of this film. But I think the debate that's happening online, we had like over 12 million clicks and downloads and viewings within the first couple of days already on the website. But even the social media X, you can see there's a debate going on, between scientists, which I love. I would like to say, I think we've jump-started the scientific method again, which has been dead. We need to be challenging each other on all these topics.
Yes. Absolutely, God, that is so true. And the discourse, I mean, it should be just constant. That is the scientific process. I read the paper, and by the way, I've Henry Ford Health. I only know them to be high quality. I'm not saying anything negative about them at all, but I did read the study, and I had a hard time understanding what they're. I mean, it was not a all right. It was a great preliminary study with a massively positive result that would, if it were published, if you were the publishing, if I was the author of that paper, I would be at the end of it saying, yes, there are weaknesses in the data collection. There's a lot of diversity of the different populations in here, but this is a strongly positive result that warrants further study, which is exactly what the research is supposed to do. It's supposed to raise a signal, much like the Tylenol signal came out, from the Harvard study, and you discuss it, and then you go after it, and maybe it's disproven, or maybe it's proven. I don't know, but there's the signal. We're looking at it on the screen right now.
Yeah,
and I don't under. I was surprised at how. I get the criticism. But I was still surprised at how strong the study was, both in terms of its simplicity, which is always a good study. It's always the simpler, the better, rather than, and again, that creates the weakness too. People weren't being parsed out into different sort of control groups and being, sort of separated into, different, sort of populations that are much alike. It was just an observation. And it asked a simple question. This is what science should do. You should ask a simple question. After kids have children, all children, are they healthier after vaccine or less healthy? That's it. Simple question. And then a statistical analysis afterwards. That's it. And it came out very positive. The null hypothesis was highly informative. We better do more study, seems to me.
Well, let me say, as you're saying, very positive. I think people might be thinking positive towards the vaccinated, but I want to make it clear it is very negative in what you're positive. You're saying you see huge disparity between the two groups, the unvaccinated, the vaccinated. The conclusion ultimately
it was informative.
Yeah. Yes.
It was informative. It raised a signal. The signal was, wow, there's a big difference in health between the vaccinated and unvaccinated. Yep, I get the criticism of how mixed the populations were and how they weren't, it was apples and oranges a little bit. So therefore, let's go do a study prospectively. How about that? Why don't we finally do that?
Well, that's exactly what this film is about, Dr. Drew. As I think now, I believe you've come into the understanding that they've never done a true placebo-based randomized controlled trial to establish safety on any of the childhood vaccines that we give our kids prior to licensure. So they've never established safety. In fact, when I sat down at that dinner with Dr. Zervos all the way back in 2016, I was on tour with Vax. Someone said I could introduce you to the head of infectious disease. When he sat down to dinner with me, he started out by saying, I've watched your movie Vax. It's very compelling, but there's something you've been saying as you're traveling the country with that film that I found really disturbing. You keep saying that we've never done the proper safety studies to be able to say that vaccines are safe. And so he said, so I sit on some of the biggest databases in the world. I went and researched that. And he said, I'm shocked that I have to sit across from you and tell you you're right. We have not done proper safety studies on these vaccines. Right. And so they never established safety. And as you've pointed out, if you want to do a prospective, any sort of placebo-based trial or randomized controlled trial now, what they'll tell you is it's unethical to do that study. And so all you're left with is what you're talking about is a retrospective study of people that have already made their choice. And that's what they look through in their own database. Nearly about 18,500 children in this study, nearly 2,000 of them are unvaccinated that have already made that choice. And they just compare them. Who has, higher rates of neurodevelopment disorders, nearly like 5.5 times the rate of neurodevelopment disorders amongst the vaccinated, 4 times the rate of asthma amongst the vaccinated. And when you look at the final conclusion, you're 2.5 times more likely to have a chronic disease if you've been vaccinated. And that graph you keep showing is one of the most shocking parts of the study. What they do is they look at over 10 years, what would the likelihood that you would be able to avoid having a chronic disease? And in this case, you're 83% of those that aren't vaccinated will avoid having chronic illness, where 43% is how low it goes. Let me reverse that so it makes sense. 57% of the vaccinated are going to end up having a chronic disease within 10 years, and only 17% of the unvaccinated. And those are huge, statistically powerful signals, as you had pointed. I want to make that clear. This is only signals. You can poke a hole in any retrospective study, but as Dr. Zerbo says over and over again in this film, this is the best you can do. And he says in the film exactly what you said. What they should do is see this as a signal and design studies to get deeper into what we are seeing, which is a very alarming signal about the overall effects of the vaccine program.
Not only, I'll tell you, I just thought of something, and I'm going to offer this humbly. There was a part of the study, I was really trying to be critical of the study as best I could, and the component where they looked at short-term and long-term complications, right? To me, that was the weakest part of the study. That's 2 different studies. You do the short term and then you do the long term, and you publish them separately. Because when you add them together, it gets confusing in terms of the science. So I would urge next time, let's just do the short term and then let's do the long term. Have completely separate publications. Because I bet you they're going to attack on that front, which is, of course, insane. But all right, I mean, that's the scientific process. You go after everything, and that's where you go. And I think when I was reading the data, I think it'll be even more pronounced when you do it that way. Actually, I think it'll be even more impressive because you'll have 2 studies, one with a different set of concerns.
There you are.
Viewers are saying that the excessive truth, Del, that you were spitting ruined the signal. Or maybe it's somebody who is concerned about the truth. I don't know, whatever it might be, but apologies for that. But what I was saying
I'm used to it. It happens everywhere I go.
Which is, well, that's interesting. So I'll prepare for it next time, the Del Bigtree phenomenon. Okay, let's switch gears a little bit. Is there more you want to say about the film before I switch to a little Maha conversation?
Yeah, sure. I mean, what I do want to say is what we really think this film is calling for is exactly what you have. This study is the most robust study we've seen to date, but it's not the only one. This is about the 4th or 5th study now that has compared the vaccinated to the completely unvaccinated. And we're seeing now a reproducible signal, which, as you know, really starts to point some fingers at the power of this issue. And so what we're demanding is, I hope Bobby Kennedy gets to do this study at HHS, but every major institution around the world, Kaiser Permanente should look at its database. We need answers to this because the entire purpose of the vaccine program was to make our children healthier. And if this study proves to be true or even close to true, it appears to be doing the exact opposite. We are making our kids sick. And as you know, we're talking about over 40 something, depending on what you're looking at, 50% of our children are now suffering from chronic disease. We have the sickest nation of children in the industrialized world, and it's the sickest generation of children we've seen in America, which is probably a good lead into MAHA, because that's what Robert Kennedy Jr. is working so hard to deal with right now.
And I was on a MAHA panel today with Rand Paul, and he parroted exactly what I've been thinking about the hepatitis B vaccine. He's a very smart physician, and when things are not making sense, they don't make sense. They clinically don't make sense, and that's a standout. It's interesting. I won a research paper competition doing a retrospective study asking I was trained as a scientist. The simpler and clearer the question, the better the study. And I noticed when I was a resident that this one antibiotic, people seem to be adding second and third antibiotics to this one antibiotic, and then the people weren't getting well. And it was, again, pharma had come in and done its thing with the surgeons and got them convinced that this one antibiotic was what they needed to put in every post-op patient. And literally, in the study I did, not one patient got well on the antibiotic. Not one. Wow. And it was a retrospective study. And I was looking at, and the only people that got well, they'd added gentamicin to it, and they sort of got well. But anyway, most people changed antibiotics before they got well. And there was a retrospective study. It was award-winning because it changed the behavior of that hospital forever. Because when there's a signal like that, you respond to it. It's just odd that we're having this conversation, where we were unable to respond to a strong signal. It's something else. But here we are.
I'll tell you, Dr. Drew, you know what's odd? What's odd is we have what they would argue is a 100-year vaccine program, depending on how you want to count it, at least 50 years. And no one on earth can produce a study right now that shows that the vaccinated are doing better in health outcomes than the unvaccinated. Right. That's troubling. How is no one on earth? So they keep poking holes at the study. It reminds me of the kid that, when you're a little kid at the roller skating rink that can't quite skate right, instead of learning to skate, they just start trying to trip all the kids going by. That's what science feels like right now. Let me poke the holes in the studies that are being done, because we can't deliver one that shows you the vaccine are healthier. I think the genie's out of the bottle, Drew. I think we really are going to see a shift in the discussions around this in the near future. And that's what I really love about this film. I think it's going to spark that conversation, that debate, which is critical right now.
So go watch it, and inconvenientstudy.com. You can watch it right now, and it looks like a very entertaining. Obviously, it's well done, but it raises some issues. Am I getting this right? Was Peter McCullough sort of a director at the Ford organization for a while?
He said he's worked with Dr. Zervos. He worked at Henry Ford. He had some real insights. And by the way, I want to say I mirror exactly what you say. I think Henry Ford is one of the best research institutes in the world, which is why I was so excited they would even do this study. So I don't mean to disparage them in any way. I believe this is a good study. I believe they're very talented, good at what they do. And so I just want to make that clear too.
And if it isn't a good study, let's do another one and then prove that it's a problem with it. I mean, this is the process. MAHA generally. We have all these previous or 6, I guess, former Surgeon Generals attacking Robert Kennedy. What is it that they are taking issue with exactly? Because I've not exactly heard. He's dangerous. He's dangerous. Oh my God.
Right.
Really? Okay. Exactly how?
Well, I mean, I put out, they're saying, he's dangerous. It's very general. And I put out a video saying, you mean the same 6 that were involved in leaving all the petroleum food dyes in our children's food, for decades and never did anything about it? The same 6 that let arsenic and lead be in our baby food, which is now finally coming out. The same 6 that had a hepatitis B vaccine with a 5-day safety trial and no placebo group. And, and for sexually transmitted disease, you're only going to come in contact.
I want to add to it. I bet one of them, one was Surgeon General during H1N1, where we had no pandemic response, none, Whoops.
Right.
We still here. There we go. No pandemic response. And the other was the Surgeon General during the hysterical, crazy shutdown pandemic response. Those two guys, you did a good job? No. Somebody did a bad job there. Somebody was dangerous, or both of you were dangerous. I don't know. I'm not sure which.
Exactly.
So this is all ridiculous. Well, do you feel like Maha is winning?
I do. I mean, I absolutely believe that Bobby Kennedy and the Trump administration, because, I mean, you need to be given the reins to really get out there and challenge all of the industries that look like they've been controlling HHS up until this point. So when you see these chemical dyes coming out of our foods, which I'm shocked that, Democrats are complaining about. I grew up a Democrat. We've been complaining about that for decades. I can't believe they're not just like out marching the streets with Bobby Kennedy on their shoulders, getting, as I said, lead and things out of the baby food. When you look at the conversation around Tylenol, this is something we've known. We've got liver issues, kidney issues, and suddenly they're coming out and say Tylenol is the greatest thing ever. I mean, it's ridiculous. We know that there's real issues with Tylenol, and many of us have been looking at autism, the way it depletes glutathione and makes it more difficult for your body to clear toxic, components, perhaps the vaccines or just in the body. This is known science and done by major medical institutions. So you're finally seeing what it looks like when you don't have a corporate controlled politician in this place, someone that is actually working for the American people. I believe that Bobby Kennedy has done more in this first 8 months than every HHS secretary put together in my lifetime. I've never seen an administration move this fast. You could go, we want to get political. I would say we're all sitting here watching what Donald Trump and Bobby Kennedy are doing and saying, we had believed that it's slow, that government takes forever, and you just can't move that, aircraft carrier. And we're watching things happen very quickly. It's an exciting time in America, and I think Maha is a huge part of that.
So I don't know if you noticed, Jay Bhattacharya said something, I forget where I even saw him, but he said something that seems to have escaped everybody, not me. And it is a major, major, major deal. So let me just sort of lay it out for you. I think you're aware that the major journals, Lancet, New England Journal, JAMA, all these journals have been adulterated, right? We saw it during COVID. Something was wrong. Now, one of the concerns was that the publishing process, the money behind the publishing, the journal, the money behind the articles that end up getting published in those journals are big pharma. And I'll even pull back from that and say, that's of course because nobody else can fund the phase 3 trials. But okay, they're in there doing that. That's a problem. That's a concern. And clearly the editorial choices, and that's what your movie's about. The editorial process is also adulterated. So what Jay wants to do, and this is brilliant, he knows there's a reproducibility crisis in biological sciences, mental health, that you in many settings, it's only like 50-50. It's like the coin toss, whether or not something's reproducible. So he has taken the position that no longer is it going to be the case that where you get something peer-reviewed and published determines your stature. You get it published in Nature, you get it published in New England Journal. No, it's once it's been reproduced multiple times, then your study gets stature. And I'm like, oh my God, that is brilliant. It takes care of the whole process. We don't have to worry about the editors anymore because what they publish doesn't matter. It's got to be reproduced multiple times.
Right. If only Galileo had thought of that, we would have missed out, so much misery. I mean, this is the problem, right, Drew? And this is as a journalist, I'm not a doctor, but this investigation I've been on since 2016, after working as a medical producer on the daytime talks with the doctors for nearly a decade. But when you start looking into this,
yes, I remember that.
There's it's not scientific. What we're looking at, there's easy solutions to all of this if you take the corporate interests out of the way. If you're not working for somebody that's trying to make billions of dollars and funding, your next campaign or what's going on. Science is very simple, as you're pointing out. Reproducibility has to be the gold standard for deciding whether or not something is effective or works. And that's what I'm saying with these vaccinated versus unvaccinated studies. That's what I think is so impressive here, is it's reproducible. Doesn't matter if you're looking at 600 homeschool schoolers or 20,000 children at Henry Ford were seeing the same signals. That is huge.
Are the numbers roughly the same in the various studies? I've not seen that. Is that accurate?
No, they vary. I mean, like I said, I think there's the Mawson study is about 600 children. You've got the Paul Thomas study that looked at all of his own
No, but I mean the
pediatric
variance.
patients. The
variance between the unhealthy. Yeah.
Yeah, a lot of times the Mawson study, I think asthma is roughly the same as you see in Henry Ford, about four times the rate. But in both Paul Thomas study and the Mawson study, you see high rates of autism. Autism didn't quite appear in the Henry Ford study, which is it's a different discussion. But the neurodevelopmental disorders, I think that's roughly 7% in the Mawson study, and in this study, it's 5.5%. So when you start seeing, these types of things, as you said, all we can say is this needs deeper research, and it needs it right away.
Yes.
And that's where I love that we've got Bobby Kennedy in there. We've got a lawyer in there, a guy that's been fighting for, cleaning up our water, cleaning up our food. I'm so tired of watching The View and these shows talk about he's not a doctor. Frankly, he's a lawyer that has been working in sciences his whole career. You have to understand how petroleum gets into water and cesium and, pollutants. So, he's a perfect guy for this. And by the way, I don't know if you saw Cheryl Hines on The View, and I say it was like watching Bruce Lee in a one-on-all beatdown. But she was fantastic, pointing out that 90% of the HHS secretaries, haven't been doctors. They tend to be lawyers, and one was an economist. So it's not even a decent argument against him. And I think I obviously was communications director for him, but he's one of the most brilliant people I've ever met. And you've never met someone that adheres more to the science and cares more about the citizens of this country. He's a truly dedicated, beautiful, intelligent guy.
That has been my experience of him as well. One of the things that I'm not seeing anybody talk about, at least I've not seen it, maybe it doesn't mean it's not being discussed, is the expense of putting things through the FDA. And my understanding, and that's where pharma comes in, because nobody else can afford the phase 3 trial and the hundreds of millions of dollars of legal reviews required to get something through the FDA. Is anybody talking about reforming that process? So it's not $800 to $1.2 billion. So somebody can get 5 years on a patent. So people that don't know, when you pull a molecule off the shelf, the patent is immediately triggered. I think you have 15 years now for the small molecules to make your profit. And it takes 7 or 8 years to get things, and $1.2 billion to get something through the FDA. And now you've got a few years to make your profit, and that's it. What a mess.
And it also causes another problem. As soon as it goes off patent, oftentimes you'll see the very manufacturer of that product come out against it, and just so that they can sell their new product that is almost exactly the same, but had enough of a change that they re-trigger. And so you can't get, like when you look at hydroxychloroquine, ivermectin, all those things that happened during COVID, no one wants to see these things used because they don't make any money. So it triggers a whole, Niagara Falls of problems. But, I think I can share it. I had a very interesting conversation with Jim O'Neill, who's now the deputy secretary at the CDC, or he was deputy secretary under Bobby. I think he's now interim CDC head. But, he was talking when we were talking before, as we were looking at cabinet, and I was talking with Bobby and all these guys and got to sit in some of the conversations. But he was talking about something that the FDA's mandate used to only be safety, that they weren't in efficacy. The original mandate for FDA was just to determine if something was safe. And it was actually pharma that somewhere around the 1960s pushed to get FDA into, efficacy. Does it work? And he makes a very compelling argument that that's where you corrupt the FDA, because now if it's going to tell you something works, it becomes the promotion for that product. The FDA is now driven to promote, by saying we give it our stamp of approval. Now you say that it works. and I think it's an interesting thought. What if we went back to just saying, you just responsible for FDA? Those are cheaper trials. We can get through that and leave efficacy to the doctor-patient relationship and the doctors that are using it.
Yeah.
That would open up competition for smaller. But pharma wants. They'll say, we don't want those. The red tape's incredible. It's ridiculous how much we have to go through to get a drug tested. They're the ones that have made it that difficult because they're the only ones that can afford it. If you just got back to safety, we could have a whole just an absolute evolution renaissance in the vaccine and drug space where smaller players could start to compete. So it's a very interesting discussion. Will this administration go there? I don't know, but it's the type of things we have to look at because that's why you can't say vitamin C can stop a cold because they've said, well, you haven't done the $100 million randomized control trial. Right. If we put it just back to safety, everyone can make whatever claims they want. Let your doctor and you decide whether you think those claims are legitimate or not. I think, and by the way, we've left the real focus on safety, which is the most important part. It's why we're having this discussion now with vaccines. Efficacy is not your biggest issue. Is it safe? And when FDA gets so focused on all the monies in efficacy, they start dropping the ball on safety. And I think that's why we are seeing this incredibly horrific chronic disease rate and all these other problems.
Very interesting. I would love to see some legal reform too. So it's not all just spent on lawyers. It's actually spent on the science. Number one. Number two, I feel like the FTC is more about safety, right? It sort of functions that way, as opposed to the FDA, which is different.
I suppose that's the case. I mean, I wouldn't say I'm a scholar on these issues. You would probably know better than I do on that function.
Yeah. Well, I have just sense of it. And I practiced medicine long enough to remember that we were using medicines that were specifically not yet FDA approved. Because before the FDA came into things like, aspirin for heart disease, thyroid replacement, these things were not FDA approved because they were out on the market long before anything to do with the FDA. So there was no FDA. So we did just fine without them, everybody. My profession kind of did okay. This is the part that's so lost in all this is getting involved in the practice of medicine. People don't belong in it. But again, now we can talk about mandates. That's the next sort of thought in my head. Mandating people do anything is just a horrific. That I predict that will be looked at as barbaric one day. That mandates of anything will be looked at with just absolute opprobrium.
I absolutely agree. Any mandate of any pharmaceutical product, or frankly, any surgery or technique is you're breaking the Nuremberg Code, the informed consent. It's why I named our nonprofit that does the work that we do, the Informed Consent Action Network, is because I believe you cannot have a free country and be forced to do anything to your body or the bodies of your children. I would say, and it even says in that first, in the Informed Consent Code, any use of force or coercion is illegal. Well, what happens if you say you can't go to your job unless you're vaccinated? Your child can't go to our school unless they're vaccinated. That's coercion. That is not supposed to be allowed. We're breaking this code that was designed from our trial of Nazi doctors that, did things to innocent people, both with drugs and trying vaccines and surgeries. So it's really important. And I just want to point out, it's my nonprofit. We won back the religious exemption for vaccines in Mississippi. They hadn't had it for 75 years. We spent 3 years in court fighting for that. And now you can exempt out of the vaccine program. We're also in the middle with our nonprofit of the West Virginia case. That is our case. We believe we're going to bring back the religious exemption. Now, that still means they have a mandate there, but you can opt out of it. And when we win in West Virginia, that's going to leave 4 more states that really are not allowing any form of consent whatsoever. But that's been my mission from the beginning. I'm not trying to take vaccines or any medical product away from people. It's a free country. If you want to, you should raise your children the way you see fit, but you can't mandate upon me and my child how we're going to live. Dr. Drew, I wasn't vaccinated as a child. I've done just fine. I want to raise my kids the same way I was raised. I thought this country allowed for that. And I would say that if you do not actually control your body, your children and what goes into them, then they're not your children. They are wards of the state. And that is where these states, when you have mandates that you can't control, you now don't have the rights of a free citizen. I would say you have about the same rights as a farm animal. If the farmer can come out and forcibly inject you and you cannot say anything about it, that's what Joe Biden did with the mandates on COVID, which was horrifying. But that's the heart of the work that I do, is to point out issues where there's a risk. There's clearly a risk with vaccines. How great that risk is, man, we need better science and we need it quick. But where there's a risk, there must be a choice. And so that is what we work the hardest at with the nonprofit that I have.
Agreed. And I thank you for that. And we got to kind of wrap up here, but I just will point out that 88 countries around the world do not have mandates, including most of Western Europe, all of Scandinavia. Only 2 of 5 communist countries have mandates. China does not have vaccine mandates. Where do I live? What country do I live in where we're an outlier with something like our own bodily integrity? It is, when you really look at where we fit in the landscape of mandates, it gets disgusting very quickly. I am, by the way, in favor of people getting the vaccine and getting educated about it and working with their doctor to get the right ones, the right time, the way you want it for your kid. But the state determining it, China doesn't do that. I think Cuba is one of the only ones that does it. I think Cuba does do it, and one other country does it. But most of the communist countries don't mandate vaccines. Communist countries. All right, and Del, one last thing. I want to at some point have a conversation with you about consenting on psychiatric meds. We are way behind on informed consent on psych meds. We have a real problem there. And maybe get in here with Cooper Davis or something and talk about that stuff.
Yeah. Absolutely. That's a huge issue. And it's why I fight so hard on vaccines. We are going down a slippery slope. What happens if your, school nurse says, I want to put, I think your kid needs psych meds, and you start having people like Pritzker up in Illinois running your kid through a battery of tests and getting into a space that they have no business being in. I think it's a huge issue, Dr. Drew, and I would love to talk about that.
I agree with you. All right. That is for next time, my friend. It is great to see you. Congratulations on the film. Future, many more battles ahead, but they seem like fighting the good fight, and I appreciate that you're doing so. And inconvenientstudy.com is where you can see it. I suggest you go right, in about 30 minutes, go watch it. We got one more interview to do. Del, we'll see you soon.
Thank you. Take care.
Thank you, my friend. All right. Coming up, we have Matt Palumbo. We're going to talk about dark money and NGOs and billionaires and what is up with those guys. I really want to know after this. I've spent most of my career dealing with illnesses that shorten life, and now we have ways to extend it and extend wellness. I've been working with the team over at V-Shred to develop a product that has everything I want in a longevity supplement. NR Boost has nicotinamide riboside. You know, metal can rust. Well, your body behaves in a similar way. It's mediated through something called NAD. NAD falls as we age, so we're less able to fight off that oxidative process. We oxidize much like that metal. And NAD fights it, but nicotinamide riboside elevates NAD so we can push back on those oxidative stressors, improving health, improving longevity. The other product is Senosync, has fisetin, one of the key molecules to fight off zombie cells, and we've added resveratrol to that, which is a well-known anti-aging antioxidant again. I don't like supplements that have a ton of ingredients. To me, it suggests that none of it's working. When I prescribe a medication, I prescribe that medicine because I expect that to work. That is exactly what I've done with these products. And I want you to go to drdrew.com/vshredmd for 10% off. Again, that is drdrew.com/vshredmd. The wellness company knows that taking charge of your family's healthcare is a top priority, and being rationally ready, and who knows what the future will hold for us. Now TWC has a service to cover your family's medical needs, including and especially prevention. For just $100 a month, the One Wellness Elite membership includes 2 free medical-grade nutraceuticals per month, free prescriptions for over 800 of the most common medications, access to concierge telemedicine available at a moment's notice, and a 15% discount on all supplements and the emergency kits. 15% off the emergency kits. That's quite a saving. So if you're spending $100 or more on supplements and meds every month, this plan will already save you money. If you sign up for a year, you'll save $200. And when you use the link, drdrew.com/TWC, you'll get 10% off the first payment to the One Wellness Elite membership. Check out One Wellness at drdrew.com/TWC and get 10% off your first payment. drdrew.com/TWC. It's all there. I'm excited to bring you a new product, a new supplement, Fatty. I take it. I make Susan take it. My whole family takes it. This comes out of, believe it or not, dolphin research. The Navy maintains a fleet of dolphins, and a brilliant veterinarian recognized that these dolphins sometimes developed a syndrome identical to our Alzheimer's disease. Those dolphins were deficient in a particular fatty acid. She replaced the fatty acid, and they didn't get the Alzheimer's. Humans have the same issue, and we are more deficient in this particular fatty acid than ever before. And a simple replacement of this fatty acid called C15 will help us prevent these syndromes. It's published in a recent journal called Metabolites. It's a new nutritional C15, pentadecanoic acid, it's called. The deficiency that we are developing for C15 creates something called the cellular fragility syndrome. This is the first nutritional deficiency syndrome to be discovered in 75 years and may be affecting us in many ways, and as many as 1 in 3 of us. This is an important breakthrough. Take advantage of it. Go to fatty15.com/Dr. Drew to receive 15% off a 90-day starter kit subscription, or use code Dr. Drew at checkout for that 15% off, or just go to our website, drdrew.com/fatty15.
Hey, Dr. Drew.
Dr. Drew. You want to spend the whole session talking about Dr. Drew?
There you go. Even you call him Dr. Drew.
All right, guys, we're going to talk to Matt Palumbo here. Just one thing before I bring him in. I was listening to the TWC ad and thinking about rational readiness. And occasionally people go, do you really think people should have those medication? Guess what? Guess what? There is burgeoning worldwide shortages of medication heading our way. It looks like, I don't know that this is true, but that the precursors that often come out of China and India are being squeezed in all this tariff battling. So you need to be rationally ready. It is rational readiness now to have these things on hand for your family. All right, Matt, I'll see where you can find Matt. You can follow him on X, Matt Palumbo, 12, Plumbo. I hope I'm pronouncing his last name correctly. The Heir Inside the Not-So-Secret World of Alex Soros is his book from 2003 and 2021. The Man Behind the Curtain, Inside the Secret Network of George Soros. There are the books. I want to read them. I can't wait. But first, we're going to talk to Matt. Matt, thank you for being here.
Thank you so much for having me on.
You betcha. Am I pronouncing your last name correctly? I always get very uncomfortable when I'm not sure.
Palumbo. It's just Columbo, but you put in a P.
Palumbo.
So you got it. Yeah.
Right. Like that. And you're not too young to even know the Columbo reference, but I'm certainly your parents. Your parents made that reference.
All throughout middle school and high school, I was getting Columbo reference. I still haven't watched the show, but I know the reference.
It doesn't. It was great, but it doesn't withstand the test of time so much. So I am sort of gobsmacked by this world of, just let me frame where what confuses me. This world of people with lots of money and or elite status who want to tell the world how to live, who want to control the world, who want to tell you how to live your life. To me, it is the strangest impulse of all to want to tell somebody else how they must live and in what circumstances they must live. It seems like, am I wrong that is sort of at the core of the impulse of these folks?
That was sort of my assessment, and that a lot of these people like influence almost just for the sake of influence. And you will notice it is almost exclusively a left-wing phenomenon. I mean, the right-wing people, if they're influencing politics, it's usually just to, lower taxes, either for everyone or for themselves. But yeah, that's generally how it is. And there was a quote I intro George Soros in the book about him, where he says, "My goal is to be the conscience of the world." So it's, a little more than just influence. He wants to influence every single person he can. And at the exact same time, he perpetuated this narrative, both himself, but through a lot of media organizations he had contact with and had funded, that you were somehow anti-Semitic for noticing that he was influencing certain groups. And, these were groups where it's not some guy in an internet comment section saying Soros is behind them. It's tax documents saying Soros is behind them. Now, his son, Alex, has taken a much more open approach, and he posts on his social media when he meets a lot of famous people. There are dozens of heads of states he's posted photos with. And I think he said it was to avoid becoming the subject of conspiracy theories, although I would say it just kind of makes my job easier, although I'm all in favor of it. So I also think he is understating still his influence through that. For instance, he had published photos of himself with Albania's Prime Minister, Edi Rama, about 36 times. And this is the person he has posted the most photographs with. I have a contact there who was in government and said that there are flight records that there are over 100 visits between the two of them. Although I'll admit I have not seen them myself. But if that is true, it's obviously many more than he's leading on publicly. I think one of the more one part of original research in the book I did with the Media Research Center had to do with all of his meetings with the Biden White House, because it would make headlines every couple of weeks in the New York Post and Fox News that he was spotted at the White House, and there would be a White House visitor log, but no one really looked into the question of what exactly is Alex Soros doing there? And similarly, it was about 30 or so visits over all 4 years. And me and Joe Vasquez mapped them all out. And in about 70% of them, there was some sort of environmental related announcement, policy related, some group getting awarded billions of dollars within about a week or two of his visit. So we speculate that that was likely the reason he had so much influence in the Biden administration. And the reason we speculate that as well is because climate is Alex's number one issue that he has chosen to make his, put above everything else. In fact, in the earliest publication ever mentioning Alex Soros, who was promoting a climate cause, and then we tracked as well, like, how is his funding different than his father? So we looked, all right, well, we decided, let's look at his climate funding. So the Open Society Foundation has public data going back, unfortunately, only to 2016. But from 2016 to when Alex took over, there was about $193 million in climate-related funding. Just since he's taken over, he spent or pledged $438 million towards climate. And a lot of the groups as well, they're sort of umbrella groups where climate is their, rallying cry, their anchor issue, but then it's a million other unrelated left-wing things they want to fund. So that's the sort of preliminary connections we found in looking into them.
What is it about the left that they seem so intent on controlling other people's lives? I mean, I guess, if you're running a communist system, the only way to do that is with a totalitarian approach. But it feels like that totalitarian instinct, at least in this country, is sort of a leaning. Like Gavin Newsom leans totalitarian. That's why he shut down the beaches and closed businesses and destroyed people if they dared to sort of assert themselves, eat outside, meet in a church outdoors. That destruction. That is the strangest impulse to me. I just can't get my head around it. But what is it about the left that they tend to go that way? Do you have anybody have any theories about that?
I remember reading a book called The Righteous Mind that argued that people, their politics almost follows their psychology afterwards. So if you are someone, I guess, who is more neurotic and controlling, you are naturally going to then gravitate towards left-wing beliefs. And I think that explanation would make sense. It is interesting to note that there are studies on mental illness by political ideology. And I think it was something like 70% of liberal women have been diagnosed with a mental disorder, but it's maybe like 20% of right-wing men. And listen, maybe some of that is due to the likelihood to seek out therapy, but to close a 50-point gap obviously takes quite a bit.
Yeah. I think Rousseau was the first to sort of articulate this impulse, which is, his essential position was, man, in the name of tolerance, you must force them to be tolerant. You have to, man everywhere in chains has to be forced to be free. And he did not seem to see the irony in that at all. You're not free enough, so I'm going to force you to be a certain thing. And of course, that immediately spirals into all kinds of nonsense.
And they're not even consistent with it either. Like they're I remember during Occupy Wall Street, there was this whole concept of the progressive stack where whether or not you could speak, they had like this pyramid of oppression. So like, obviously, if you're a white guy, you're on the bottom. If you're whatever, you're on the top. But their rules don't apply to their own people. Like, they would justify Charlie Kirk's assassination by claiming he's homophobic. But someone in the Palestinian world actually is homophobic, and you would be insane to justify killing them based on that. But they have two standards, and the left only really has standards insofar as they can use them against you. In that they're fine making fun of gay people as long as they're on the right. They're fine attacking women as long as they're on the right. And I know it's sort of like a cliche to say, imagine if the roles were reversed, but they are hypocrites, and there's no denying it.
How did you get involved in this?
So I've been interested in politics for a very long time, since I was younger. I was also interested in finance and economics, and I studied finance in college because I thought, the odds of being a TV pundit are probably round down to 0%. So I'm glad I proved myself wrong. But it turned out what I learned in business school also doubled over very well in politics, and that, learning finance and economics also helps with that sort of analysis. And I was in business school and I was working the night shift over at the local Dunkin' Donuts one night, and I had maybe an hour or two to kill. So I watched a documentary called Inequality for All by Robert Reich, which was Bill Clinton's labor secretary. And, as I'm going through it, just taking notes on what I thought he was getting wrong. And I found a website to publish my critique, and I was 19 years old at the time. So this is 12, 13 years ago. And I wake up the next morning, and Dan Bongino, who back then he had, I think, 2,000 Twitter followers. He was a fill-in host at the time for like Hannity and Levin, but this was before he got really big. And he's tweeting like, "Oh, everyone's got to go read what Matt Palumbo just wrote," and like telling people to go follow me. And I'm thinking, all right, well, this is kind of cool. Like I just write one thing and I'm getting attention for it. So him and I have kept in contact for a very, very long time. I would, send all my work to him. And once he started the podcast back in, I believe, 2013 or 2014, he made me sort of his resident fact checker, where he would just send me stuff to fact check for the show, and he would bring me on to talk about stuff. And we've been friends for a very, very long time. So back in 2019, I started running a website called BonginoReport.com, which is his alternative to the Drudge Report, and I've been doing that for, I guess, 5 or 6 years now. So obviously, I guess I'm technically my own boss right now with him in the FBI, but he is my boss. Yeah.
Nice, well done with him and the FBI. Let's dig into your financial heritage a little bit, and let's talk about NGOs and dark money. This is another thing that I'm sort of gobsmacked by. I'm gobsmacked by people's inclination to tell other people how to live. I'm gobsmacked by how ossified the elite is. I'm gobsmacked by the craziness that went on during COVID. And I'm gobsmacked that there are things called NGO that put our money through them to do whatever anybody wants, it seems like. What is going on there? Are we going to undo that? Is there some loophole in the law that there is some smart person figured out this is a way to do it, or has it been around since the 18th century? I just didn't know it. What is the dark money in the NGO system, and why does it seem almost exclusively on the left? What's wrong with the right for not exploiting the same thing? What's wrong with the right? Why aren't they doing it if it's legal?
I'm always saying, like, billionaires, please, I have some good ideas and all that. No, the NGOs, I believe it was in the 1980s, they started getting preferential tax treatment. So I would say just do away with that. But the irony is we learned during the whole USAID debacle that, they're called non-government agencies or organizations, but many of them were getting the majority of their funding through the government. And one of the things that George Soros did was he weaponized all the ones that were getting USAID funds, and that in 2009 under Obama, or I guess to give some background, he's been working with USAID since at least 1993, has done thousands of deals with them. So it's a ton of leverage over them. And under Obama, he was able to get the rules changed where to get U.S. government tax money, you had to sign on with certain progressive ideals. So pro-LGBT, everything being pro-prostitution, basically every progressive issue you could imagine. Even if these were for groups that were not in any way political, he would sort of force them to publicly proclaim those ideals. So Soros moved any NGOs, even if they were previously apolitical, to the left through USAID. So that was one major thing. And then they also, I mean, they're supposed to, again, be non-government agency organizations. They're supposed to be complementary when a government is not able to function and provide on its own, but they most often try to sort of subvert governments. A large chapter in the book is about how George Soros used the country of Albania as sort of a playground. And it's a country, obviously, most Americans are not thinking about too often, but it's a very useful chapter in understanding just how he subverts nations. And I was able to speak and sort of get to know the country's first president in researching the book. And he was telling me, like, when he became president after communism, Soros comes in and he's giving him all this money and saying, you know, we're going to build up all these schools, these hospitals, it's going to be great. And then he realizes very early on, well, all the schools he's funding are teaching the far left politics they just escaped from. And, so that's, one of the ways is they use it to launder left-wing influence.
Yeah. Interesting. And when we say dark money, what exactly are we talking about?
I don't have my own definition. I mean, I just think big money almost I use synonymously, but money that is hard to track. And I would say there can be dark money that starts out not necessarily as dark money, in that one of the things that Soros does that is unfortunately smart is that he layers the money, like as if it is being laundered, and that he gives to funds of funds of funds. And by the time it ends up in a group's hands, he has the ability to say, well, it's not my money. I mean, my money may have been a certain percentage of this group's budget, but you technically can't prove it. And groups like Tides are one of those. But in the last chapter of the book on Alex, I wanted to go through all of the groups that Alex had funded his first year running the OSF. That was 2023. And there were about a half dozen that were extremely suspicious in that he would give them, $10 million. Their spending would be $1 million, and then you go down their financials, and their computer's expense, internet expense is $0. Their office expense is like $100 a year. They have a bunch of board members who work 1 hour a week. Just these weird things, and then all of the money was just going to grants, or it would be money going to what is supposed to be an activist group. And again, the financials would just be bizarre. And the website would be show people doing activism, try to make it look active, but the social media wouldn't have posted in a year. They would have a YouTube channel that's getting 5 views a video. There'd be no actual news coverage of any of their spending. Just a lot of weird things where you're wondering where the money really is going. And I think that's probably in the same category. I kind of flagged them for, in the category of if the IRS ever needs something to do, maybe look into these kind of groups. But just a lot of very suspicious funding.
It's like the NGOs funding other NGOs is a way of sort of laundering things through. Yeah.
Yep.
So, I'm seeing also that some of this money ended up opposing Trump's National Guard deployment in D.C. Am I seeing that this money appears to be less effective these days, particularly as people have sort of pulled the curtain back and seen the wizard behind Oz?
I think definitely when it comes to funding certain politicians, like at the national level, it's harder with the lawsuits because a lot of it too depends on the judge, and that there have been some Soros-linked lawsuits where they get that Judge Boasberg, who is a Biden donor, and you're kind of screwed at that point. He has doubled down as well on a lot of the local DAs, and one of them that stood out was Mary Moriarty. She was the Hennepin County DA, and she is one of the people that was very much opposing Elon's efforts He's actually funded a lot of the anti-Doge stuff too, but he's funding a lot of people that are actually too crazy for his father. And that Kim Ogg was a Harris County DA, George Soros funded, and she ended up turning out to be more moderate. Like, she didn't go along with the bail reform stuff or a lot of the stuff Soros wanted her to go through, George Soros. So, it might have been George was betting that he could corrupt her with the money and it failed. But anyway, Alex then funded a primary challenger to the woman that George Soros had funded to get into that position. And it was like a 75-25 blowout in the Democrat primary. And then he won by like a point or so in the general. So there are certain people that are too crazy even for, they were not crazy enough for Alex, I should say.
And what do you tell people, or how do you argue when there are people out there saying there's no such thing as Antifa, it's a fantasy, it doesn't exist? What have you uncovered?
Well, they know better. It's a talking point where I don't understand who the target audience is, because before Trump was going after them, they had no incentive to deny that they were a group. So they would acknowledge Antifa or do this stupid argument where they were like, the true Antifa were the men who fought in World War II. And I'm like, no, they would have actually hated you people way more than we do, actually. But no, it's a semantics argument. It's, they don't have a headquarters or a tax ID. So the mafia doesn't either. I mean, we all acknowledge that you can be an organization without incorporating. And there was a guy who wrote a book called The Antifa Handbook. He was actually a Rutgers professor. Yeah. Keith Ellison promoted the book on his Twitter back in 2018. So clearly he thinks Antifa is a group. I'm sure he now denies it. But that professor, in the wake of Trump announcing the crackdown, fled the United States of America. So again, if it's not a real group, if it's an idea, who exactly what is the need to flee? They clearly know otherwise. And Antifa themselves, I mean, you can type Antifa into Facebook or Twitter and it's Antifa, insert municipality here. It's all these different branches. So I'm not sure what they think we're supposed to make of that. But it's one of those things where I can't tell if they're dumb or pretending to be dumb. But it's one of the two. Those are the options.
Well, I'm trying to get the connection between the totalitarian instinct, denial of things that are obvious, Trump derangement syndrome. These things all seem to kind of go together. And I can't link them all psychologically yet.
I don't know if anyone can. I guess that psychologist would make a lot of money if they could fix this.
Well, it's a lot of it. Some of it's just hysterical, sort of borderline personality hysteria, that kind of thing. And I talked to a expert on narcissism, and he was saying that yes, we have gone from narcissist to more predominant borderline, and part of borderline is projective identifications. Everything you do, you see out there. Yeah. And you have hysteria very easily. You get just hysterical, and a lot of unregulated aggression and hostility.
Well, you even see that. You even see that with the people who are targeting Trump legally, like Letitia James going after the mortgage stuff. She must have thought, well, I know I do this crime, so I'll see if you're doing that too. It's everything they do is projection.
Yeah, it's kind of wild. Well, listen, I've enjoyed this conversation. Is there anything else you want our listeners to sort of be aware of? I'm just looking at the book, and gosh, there's just so much craziness out there. Anything I missed?
No, I think it was good. I obviously love to come back anytime to talk more about it, and I think they'll like the book a lot. It's the same length as the book I did about George Soros back in 2022, but I'd say it took about twice as long to write, just because it was so much more original research, as opposed to going through a million reports and synthesizing them. So it's a lot of very good info that's original to the book. I think they'll like, and he's going to be in charge probably the next 40 or 50 years. So good information to know.
Yeah, I mean, I love the man behind the curtain as a metaphor for all of this, because as people, just the fact that people are aware now that demonstrators are paid, and I was even hearing that employed demonstrators have unions now, or a union exists somewhere, which is incredible. Look that up for me. I don't know if that's
actually news to me. That's incredible.
Yeah, that's what I heard. I didn't confirm it, but came from a decent source, but I didn't confirm it. Find Matt on X, MATTPALUMBO, Palumbo like Columbo 12, Pat Palumbo 12, and get the air. And And where do they go for the Bongino report?
SponginoReport.com. Oh, I should mention with the book, I screwed up with the title. There's a best-selling series called The Heir that is destroying my SEO. So search The Heir Alex Soros or The Heir Palumbo, and you'll save yourself a page of search results probably.
There you go. Matt, thank you so much for joining me. Talk to you soon, I hope.
I'm glad
I
you
hope so
said
too.
that.
Thank you so much.
Yeah, exactly. Me too. So we get some books.
I mean, it's so funny because when
Is your mic on?
Yeah, I don't know why it's not working.
Yeah.
When you Google stuff, it's always so frustrating because it doesn't just pop up.
Yeah.
I'm glad he explained that. So he may sell more books.
I hope so. It sounds like we should all be educated about this stuff. Certainly, I know I should. Okay, so coming up, let's put the schedule on for tomorrow. I know we've got the TWC's guys coming in here. I don't know if Gary Brecka is coming with or not. Do you have an update on that, Caleb?
That's the latest. The latest I know
Watson.
is there's going to be 4 guests tomorrow. That's the latest. So.
Okay. And Foster is the founder of TWC. Peter Gluley is the CEO.
It's going to be sponsor day.
Yeah, sponsor day, right. But I want people to get a chance to pick Peter and Foster's brain.
They're entertaining.
Gary, I will presumably be just talking about some of his stuff.
They're very successful sponsors, and they're doing good for America.
I just mentioned, Susan, you were away, but that I'm hearing that there are problems with certain pharmaceutical manufacturing. So there are shortages around the world. So in terms of being ready, being rationally ready, get your emergency kits, guys. I used it.
And Fatty 15, of course.
Fatty 15. Well, that's the longevity side, which is in our boost, Fatty 15. Get these things. They help you. Trust me.
Drew, I was looking up for the biggest, the union of paid protesters. I'm not sure if this is the one you're thinking of, but there are multiple unions that actually have lots of members and pay members to go do protests. They have.
That's different. That's
different, but it's
different. That's different than
you're thinking of like a casting company that basically hires people to go out and protest whatever.
Yeah, your job isn't truck driver, and we're going to send you out to protest, and we'll pay for your day. Your job is protester, and then you also unionize. So
if any of those people involved in that, like a professional protester, wants to get in touch, then I would love to speak to someone who does that because they're keeping it real quiet, but you can tell some of these people are getting paid. They don't know they don't have talking points. They don't know what they're saying. They're just standing there at the sign.
Well established. That's well established. And the signs are all professionally distributed and manufactured and stuff. So, all right. So thank you all for being here. I was going to go over the rest of the week for next week. If you want to do that, Salty Cracker, I know, is coming in. Peter Navarro's coming in next week. Todd Rose coming in, and we're going to have somebody on the 29th. I'm having surgery on the 23rd, basal cell cancer. Don't spend time in the sun, but that's going to take me out on the 23rd and may take me away the first part of the week of that week of the 29th. We'll see. Hopefully not, and or I'll be here with a bandage on my head because I will happily do that if you guys want me. Let me look at the restream. See if you guys. If
you're over on X and you want to go watch Salty Cracker, he's live right now, and also our friend. Yeah, so I don't know. We have better numbers than him, so maybe we're taking his audience.
Can we raid his?
I'm going to raid him right after this. I'll raid him.
Yeah. He may be on. We'll do that. Thank you for all our fans today who came to this later show. It's a new time zone. We're going to be here at 4:00
on Wednesday.
Only on Wednesday. Caleb's working with Maha, and we did a little something with him today. It didn't work technically, but it wasn't Caleb's fault. I just want everybody to understand that. Mm-hmm. But yeah, we're going to be here late on Wednesdays, and we appreciate if you share, if you care. It's not our usual suspects, although I do see molten salt on Rumble, and it's like a different group, but we have to get the word out to them.
Tomorrow we're at 2 Pacific. We will see you then.
Ta-ta.
Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published.
If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.